Alors, bonjour à toutes et à tous. Bienvenue à ce point de presse.
Good day. Welcome, everyone. Welcome to the Salle Dumas. We have our press conference now. Mr. Christian Dubé, Dr. Horacio Arruda, and the Premier of Quebec will speak now. You have the floor, Mr. Premier. Thank you. Yesterday we had 1,162 cases. As we can see, we were able to reach a certain plateau during the last weeks. But now for a few days, there's an increase in the number of cases, unfortunately. And so there are different regions, contrary to the situation in spring. Several regions have seen a lot of cases. And perhaps for those of you listening to us, I've tried to summarize things, and I broke the situation in 3 categories as per the 17 regions of Quebec. There are 3 regions only, unfortunately, where there are few cases, where things are going very well. The Abitibi-Témiscamingue, the Côte-Nord, North Shore, and the Bas-Saint-Laurent, the lower St. Lawrence region. There was a time when it was a little bit more difficult there, but now things are under control. There's a second category where we find 9 regions where it's rather a stable situation. First of all, Montreal. Montreal is in a stable situation, even though we're following up on a few areas, Dorval, Lachine, La Salle. There are more cases in those regions. And so Laval, Laurentide, l'Outaouais, this remains stable. The Montérégie also remains stable. There is one place where we find some outbreaks, Richelieu, Yamaska. In the Quebec capital region, we can talk about slowing down in the number of cases. This is remarkable during the last weeks, but the cases remain high. This is too high. Indeed, I'm referring to Quebec, Quebec City. And so there's an outbreak which is significant in the Charlevoix region, the sub-region. In the Chaudière-Appalaches also, things remain stable. But there is an outbreak which is added on to Montmagny-Lillet. And so the situation is quite tight in the Beauce region, but Montmagny-Lillet has become the region where, all things being considered equally, there's the greatest number of cases. The eastern townships, up to a few days ago, this was a region which was ranked amongst the first categories in the sense that there weren't a lot of cases, but there was a big outbreak in asbestos granite yesterday. The Minister of Health, the public health director, unfortunately had to decide that the eastern townships had become a red zone. The north of Quebec also, not a lot of inhabitants in those regions, in that region, but 17 active cases. We look at that closely given the fact that it's a remote area. There's a third group where things are not going well at all in 5 regions. And these are 5 regions which are concerning. First of all, the Saguenay-Lac-Saint-Jean region. And then this is pretty much spread everywhere. We have issues at the lake, and in the Saguenay also, in the Jonquière sector, as well as in the Chicoutimi sector. And we face problems also in the La Baie region. The region where things are harder in Quebec, it's the Saguenay-Lac-Saint-Jean region in Quebec. The second region where things are hard, it's the Lanaudière region, mainly in the Joliette region. There are a lot of cases, indeed, in the north of Lanaudière. And after that, we have 2 regions. They've been working together, partly, it's the Maurician Centre of Quebec. In the field of health, they've been working jointly. There are significant outbreaks in Trois-Rivières, in the center of the Mauricie, at Batiscan, and at Arthabasca-l'Érable. For the Mauricie, as well as for the center of Quebec, well, we can see that there's work to be done. Unfortunately, there were more interpersonal contacts during the last weeks. And another difficult area is the Gaspésie. It's difficult there, but it's mainly focused on the Côte de Gaspé region, where it's more difficult with a lot of cases during the last weeks. As you can see, the majority of regions, they have reached a stable level or they are increasing in the number of cases. we might find some consolation in looking at the number of cases per million of inhabitants. There are many countries. I'm referring to the United States. I'm thinking about France. I'm thinking about most European countries where they have twice the number of cases per day, new daily cases, all things being proportionally analyzed. And we can say we resist more, or maybe there's a different perspective on that, a different way to look at it. We might ask ourselves, is this what we can expect to get within the next weeks? Of course, we're extremely happy to have reached almost half of the gravity of the situation in terms of the number of cases, but this is still the second wave. The second wave is not starting at the same time for everyone, but if we look at the numbers since September 1st, we can see that in Quebec, it's less impacted as the rest of the world. 2 weeks ago, we've announced that we were going to add measures, guidelines for restaurants, for gyms, for sport facilities, for contact sports, for theaters, and so on. And we've promised you that after 2 weeks, we would analyze the situation and see where we are at. After taking stock of the situation, unfortunately, we can see through indicators that, unfortunately, we have to be more prudent. Unfortunately, we weren't able to curb this and limit the number of cases during the past days. We see an increase in the number of cases, indeed. So I'm announcing that, unfortunately, for the 2 next weeks, the measures that have been announced will remain enforced. We told you initially that this would last 4 weeks, but that we would review the situation after 4 weeks. Now we're really telling you it's for 4 weeks, at least until November 23rd. I understand this is hard for the population to follow the implementation of guidelines and to continue following those guidelines. But still, we have to look at the full portrayal, the full situation. 97% of the children are going to school currently. 97% of workers have now gone back to work with their initial job that they had in the month of February. So still, we can look at the 3%, but we have to consider that there's those numbers, those 97% numbers, and there's that possibility of keeping children in school and workers at work. This is due thanks to the measures we've implemented. I mean, there is transmission. There are contagions in workspaces, in schools. Let's not kid ourselves, but we believe that it's extremely important for kids to go back home and for workers to earn a living going back to work. So because of that, we can accept that there might be this possible contagion. But once we leave those working spaces, that's when we have to keep following guidelines in terms of restrictions. For several reasons. First of all, to save lives. Number two, because we want to keep workers working in their work setting, and we want to keep children at school, and we want to keep control over our healthcare system. We want to continue to deliver healthcare to the people who are sick and or ill, and who have other diseases that are not COVID-19. And also, the holidays are around the corner, and as I said, and I wrote, we should not expect big parties during the holidays, but we'll do as much as we can so that we can hold smaller parties so that family and friends can meet together during Christmas time and the New Year's Eve. It's too early to tell you about this, but the more we'll work on this until December, the better it will be a situation, and then it will be easier to perhaps alleviate things and relax things a little bit in terms of measures. Yesterday, we've heard a very important news, which gives us faith, a lot of faith. Pfizer and BioNTech, the German company, well, those two companies have announced that there would be a vaccine with an efficacy of 95%. We're verifying things at Health Canada. We're talking to the federal government, but this is still great news. However, what we understand is that this will require a few months still before we can give the shots to most of the population. Unfortunately, we still have to continue working for a few months. We don't believe that right now it's necessary to add additional measures. However, what's necessary, and more specifically for the 5 regions where things are a little bit harder, we need more people that comply with the measures. In the regions where things are not going well, it's very likely so that there were more interpersonal contacts during the last week, so that we need to reduce the number of contacts and we need to follow guidelines. Something also that's important, it's the situation that CHSLDs face. You can see that we have a small increase, a slight increase on a daily basis in the number of CHSLDs and the number of residents that are infected, in those residential and long-term care centers. The Minister of Health has conveyed a very important message, and I want to stress that the CEOs of the CIS and the CUSIS and the managers of the CHSLDs have a duty to ensure that everybody wears a mask, that everybody is using the protective equipment whenever they go visit patients or residents in their own room. This is extremely important. I insist. We are on the same wavelength, me and the Minister of Health. CEOs are responsible for results. It's a matter of accountability. Now, something else I wanted to say, when you are infected, when you have symptoms, or when you have been in contact with somebody that was positive, that had positive diagnosis, the least you can do is to self-isolate. I'm hearing all sorts of stories. This is really bad. If you know you've been infected, if you know that you might run the risk of having contracted COVID-19, self-isolate, please. It's a matter of self-respect, and it's a matter of life and death for other people around you. So there are lives at stake. So we continue maintaining a balance, the right balance between saving lives and maintaining a quality of living. I think we've reached a certain balance. Of course, there's hope. On one hand, within a few months, and I want to thank all Quebecers, obviously, for your efforts. Thank you.
Good afternoon, everyone. The numbers of new cases was stabilizing, but we're now seeing an increase in recent days. The situation is stable in most regions, but we have 5 regions in particular where we're seeing a major increase: Saguenay-Lac-Saint-Jean, Lanaudière, Mauricie, Centre du Québec, and Gaspésie. 2 weeks ago, we told you that we would reevaluate our restrictions if the situation improved, but our numbers show us that we must be even more careful. I'm announcing that we'll keep the same restrictions for at least 2 more weeks. I understand that the situation is difficult for a lot of people, but our measures are necessary to save lives, to keep our children in school, to keep our workers at work, and to save our health system. It also gives us a chance to see our friends and family at Christmas. So we have to keep hope. Yesterday, we saw that the work for a vaccine is going well, but we must remain very careful. It will take months before we can vaccinate a good part of the population. We must continue to follow public health rules, and we must maintain the balance between saving lives and our quality of life. Thank you all for your efforts. Thank you.
Merci beaucoup, Monsieur Legault.
Thank you very much, Mr. Legault. Mr. Christian Dubé and Mr. Horacio Arruda will answer questions, first of all in French and then in English. Question from Radio-Canada. My first question is about ventilation in schools. Parents have a concern. Teachers have a concern. The opposition parties have talked about this in their press conference. Today, it's each one of the service centers that send directions on that. Will there eventually be a national plan for that? Guidelines that might be enforced wall to wall, as we say, even though the fact that some schools are more older than other ones. Thank you very much. We've talked a lot about this with Dr. Arruda. It's broader than for the schools. What we want to understand here is that there was a first announcement with the first vision in spring that was announced. And we have to remember that given the context, the opinion that was stated at the time, the World Health Organization had not discussed yet about the aerosol spread. And that's why I've asked Dr. Arruda's team and the ISPQ to go back to the decision that was made after the WHO's announcement. This is quite recent because there might be a more significant percentage of the spread which is due to that. I mean, there's two sides to any story, right? And there are studies, but this is a clear matter. We will think about that. We've asked the ISPQ to come back to us on that for our schools and other facilities because it's even more important, because if we need to act, we need to act fast. And the best answer I could share here is that when we had to make decisions in the past regarding air conditioning in the CHSLDs, everybody said that this was impossible, that we could not do it. I say, on the contrary, if we need air purifiers, if we need to adopt temporary measures, they will be costly, definitely. But that's why I've asked for an update from an experts committee so that we can look at a ventilation matter, not just for schools, but for our different facilities. Now, with that advisory, we should get a report pretty soon. My second question is about hope. Hope about the vaccine, which should be ready in 2021, in spring maybe. Are we preparing logistically? So, because this won't be like H1N1. We won't be able to, wait for vaccinations, for shots. It's complicated with the flu vaccine situation and so on. There will be long lines and so on. And there are specific conditions also, because it has to be kept at a certain temperature, right? The vaccine, I think, minus 20 degrees or something like that. Answer, you're well informed. That's why we've added someone on the operating side of things at the health department, Jérôme Gagnon, because there's a whole logistics that has to be considered here. I'll give an example. This is for Pfizer, but amongst things, most cases are similar, by the way. What this may require in terms of logistics, it's a case for Pfizer. This is a vaccine that will be provided in two steps, two phases. There will be a first step, a minimal step, in order to create an antibody, generate that, and then people will come back. So the appointments, logistics will be different and difficult because there are two steps. Now, in terms of the temperature, you said minus 20 degrees. I've heard minus 70, so you need a good type of cooler. So we've tried to ensure that we'd have the right logistics. Our people have already purchased the equipment, so that's safe. We have about 60 different coolers that have been purchased so that they could be sent to the right places on the right time. So the discussion we've been entertaining with the public health authorities is to look at how things will be considered. For example, who would be the most vulnerable people, who should be priority to receive the vaccine, and so on. So we focused on that, and we have a task force, and this needs to be operating in terms of logistics. We still have time to prepare well, but we need to have the right people aboard. Question from Metro, François Carabin. First of all, gentlemen, maybe Mr. Legault can answer this question. What's the impact that the high levels of transmission in the Montérégie-Lanaudière region, in the Saguenay, what's the impact of that on centers like the Montreal Island, the greater metropolitan area, and regions like Quebec? This is not funny. I mean, this is not the right word. But what we see a lot today is that the contagion the community contagion, this is what's the most troublesome right now. It's more found in the regions. And when I say regions, I must be careful here because everybody believes that we live in a big city. And by the way, I was yesterday in the Lac-Saint-Jean and Saguenay region, so I want to be careful. But this is in regions of Quebec that were not faced with difficulties during the first wave. So some people believe they're not vulnerable, right? And so when you think you are less vulnerable, you lower your guard, and that's the thing. And in that sense, I believe that community contagion was greater in those regions, and so that's what I was explaining yesterday to the people from the Saguenay-Lac-Saint-Jean. Now that we've had a confirmation of that, we know that there is community contagion. This means we must work even harder, unfortunately, for all sorts of reasons. Now, the spread is reaching our facilities. Why am I creating this distinction? I'll speak fast here, because we may have contagions, spreads in schools, in work settings, and so on, in different places, but results are not as impactful. The incidence is not as bad when that contagion enters through a visitor into a CHSLD or into, those places where you find a lot of vulnerable people. There will be deaths as a result. I've told the Premier about that. When we give our update to the CEOs, we did that yesterday, by the way, we come up with an update with precise actions. We update our plan, right, because we had been submitting our plan for a few months, so we need to update it. So we'll stress more on the regions. We'll focus more on that because the greater centers, the Quebec City region, the Quebec City region and Montreal, I mean, they did well, but it may be in the regions where you had more community contagion. So this has an impact on our different care facilities. So that's when we need to fast-track our communication plan. That's what I alluded to in my letter. Question. To come back to the Pfizer vaccine, the federal government has requested 20 million doses. That's what was ordered. What about Quebec? Answer. I have to be careful here. I don't want to give you confidential information, but the federal government has negotiated with 6 or 7 different providers. At the same time, then, with Pfizer, the federal approach is the right one. It's to ensure that, this will be the first one because so much the better. Pfizer has an edge here, and other ones are working very hard, right? But we ensured with the federal government that we would get our share. We made sure of that, and so we have conversations with the health department, and so with the minister office, we provide follow-up with the government of Canada, and we deal also with providers and in terms of logistics, as I said earlier. It's not just with Pfizer that we are having those discussions, but we want to have our own share of who will be the winner of the bid. Question, in what proportion? Answer, there are different proportions, but I want to keep our secrets of state for ourselves a bit, but I want to make sure that we get our share. We will proceed faster now because we only have 30 minutes left. 2 questions per journalist. Ms. Siwi from Le Devoir. You've talked about accountability today. Again, earlier, Mr. Dubé, you said that the confidence link has been broken between the CIUS and the Quebec community. There's a difficult situation in the Saint-Eusèbe CHSLD. Do you support that the CEO of the CIUS from La Rivière, should he stay in place? Answer, I said that this relationship based on confidence should be reestablished. So between the CIUS CEO and the Quebec community, this must be mended. So that's why we undertook some precise actions. Remember the announcements we made last week with my colleague Lafrenière about training, specifically, and other measures also. So this is, we've made a step towards the right, we're on the right track here. So what's happening in Joliette and La Loudière specifically, I want to be careful here. I don't want to take an exceptional case here, but I've asked for a detailed report about the events that occurred, and the Premier said it. We don't have just one CEO, but we have a local person in charge of the situation. It's a lady in this case, but I want to know what was done. I want to have a detailed report about chronological facts. Remember the steps that we undertake when we have a case like that, which is difficult. It's not just local people working. There are people from the CIS itself, in and of itself. So we have people from CUSUM that are on site with their own expertise, their own knowledge to check whether or not all the recommendations have been implemented. Is that enough? Well, I would say, lastly, that I want to have detailed recommendations about the meeting comprised of the different CEOs. This occurred yesterday. I want to compare what happened at the Saint-Eusèbe CHSLV. Compare what happened with the best practices. It's going to take a few days before we can really understand the situation, but this is a file that's on my office. Question. Who's responsible in that CHSLD, Saint-Eusèbe, PCI? Who's in charge of that? One contaminated person was able to come back into the facility. Answer. We have to understand what happened precisely. I got a preliminary report after a few days, and this is why this is a difficult situation. Allow me, please, not to get in too many details, but again, there was an asymptomatic person. In reality, there were two people, two asymptomatic people that were there that got into the facility. Not just one person, two people were involved. So all I can say is that I'm dealing with the file, and I'll tell you eventually what happened. This is a beautiful case in the sense that when I wrote the letter and I sent it to the CEO, I wrote this on a Sunday morning. There's a reason for that. It's because what I heard from all or most of the CEOs is that there was a negligence on the side of employees. But again, I want to be careful here. It's not their fault. It's a joint responsibility matter. The Premier said this. It's up to our CEOs to ensure that everybody that's in place, starting with the local responsibles, that PCIs be complied with. So to answer your question, once I am certain that I understand everything that occurred at this specific CHSLD, then we'll do the deeds that we must do. Question? Mr. Minister of Health, Dr. Arruda, Mr. Dubé, you said that Quebec will have its own share of vaccines. We understand that we have 20 million doses, which was reserved by the Government of Canada. We should expect those at the beginning of the upcoming year. If we take the proportion of Quebec, this goes around what? We're talking about a ballpark figure of 5 million doses, which means we need 2 doses in order to get vaccine protection that would be complete, which means we won't have vaccines for everyone in terms of full coverage. So who is the priority, Dr. Arruda, with these 20 million doses or 5 million doses? Who are the priority? Who will get the vaccine? Answer. As is the case for each vaccination campaign, there aren't vaccines for everyone. Our experts provide recommendations in view of the people that would benefit more from the shots in view of its efficacy and so on. We break down things by groups. To give you an analogy, referring to what happened for H1N1, you have the healthcare workers. This is a different, separate category that we need to consider. And so there are other clienteles that will benefit the most from the vaccine. People who are the elderly, the older people, the seniors, because they have high mortality rates. All of this will depend on the data that will come up in terms of efficacy. We said that the efficacy was 95% for this vaccine. We know this may vary depending on the age categories. This depends on the experts' recommendations. They'll look at that. This will be discussed. There's the CCNI, which comes up with preliminary recommendations. Even before receiving a first analysis, which will be improved, we have the Quebec Immunization Committee that will do the same thing, and then we get a recommendation. It's the Minister of Health, which, in view of those recommendations, provides a certain information. And so there's this first vaccine, but other vaccines will eventually be ready with different characteristics. We'll follow up on that. Question, 2.5 million people getting a vaccine. Is that enough in order to create some situation where we would be some community protection in terms of innocuousness, in terms of harmlessness or safety? Answer, we should not divide the 5 million by 2. When we talk about the dose or vaccine that would be eventually available, you've talked about, what, 25% or what, a certain percentage of the population. I'm talking about the 2 doses of the vaccine. We'll be able to provide the vaccine to 5 million people. We don't divide things up. You know, we don't make a difference between those that will get the first dose and then the other dose. No, it's for all of the people. Every 5 million people will get the vaccine. Question, I didn't understand that. It's 40 million doses or what? Answer, it's 20 million vaccines so that the person can get the dose, the first dose, and the second dose as well. And that's why it requires a lot of coolers. Question, so is this enough? I insist. Is this enough to create some community safety or answer, this will be sufficient. This is enough. That's why we start with those people, those that suffer consequences. But to prevent a community transmission, we need vaccine coverage, which is around, at a minimum, of 60 to 80% in terms of coverage. If we want to stop the spread of the virus, that's what we must do. Question from TVA Nouvelle. TVA News. Mr. Premier, the Canadian Prime Minister said that provinces should not be influenced by the pressures from the public, given the current contamination, in order not to close businesses and the society. What do you think about that? Answer, I didn't hear what he said precisely, but as I said earlier, 97% of jobs that were in existence in February came back, which means that the economy is working still. Relatively speaking, it's working relatively well in Quebec. And our intent is obviously to further that approach. There's an update that will be submitted on Thursday and will continue helping both individuals and businesses. So I need to see what was said by the Prime Minister or what his intent was. Question regarding the issues that CHSLDs face, that residences face. I mean, we're facing what other regions have faced. Has your communication plan completely failed? Answer, I wouldn't say that. I'm not sure that that's what you're trying to say. You're just asking a question. But I would prefer saying that we need to make an update currently, given the current situation, because given the impacted zones on the first time, measures were well enforced and people then were able to monitor things well. I'd like to go back to the basics here. Why do we talk about prevention and control monitoring? It's because our foremost objective is to prevent the spread of the virus. We have to do everything to curb the spread. Once it's in, we have to monitor. I'm insisting we have 400 CHSLDs, a little bit more than that. There's 50 CHSLDs where we find cases, 51 to be more precise, and there's less than 10 when we say that the situation, there might be a loss of control. But anyway, we've done a lot of prevention. The most important thing is we need to act quickly if there is a contagion in one of those facilities. That's why we asked people to resume the rules. We've asked a specialist to come in. It's a lady that has succeeded well in her own region, and she shared her best practices with our CEOs yesterday. And after that meeting with that expert, we know that we will be able to make the necessary adjustments in the respective regions that I've named earlier. And if I may say one thing, I have 2 big cardboards here, and I want to make sure I haven't brought them for nothing. I want to complete what the Premier has said earlier. The two charts I'm going to show you here on this cardboard, I mean, you have those on our websites. I'm talking to the journalists. You want to get them ahead of time. But they're available on our website. What I want to say is that what you see on those bars, you have blue, gray, and black zones. This is the region of Montreal, the 7 weeks since the beginning of the big wave. I'm talking about the Greater Montreal region, the CMM. So during those weeks, we see that there was a fluctuation between 55-65%. The darker zone here, it's for the Quebec and Chaudière-Appalaches region. What's interesting here is that, remember, when things got worse in Quebec, you see that the increase reached even 26% for Quebec, which is more so than its population share. And the Premier was alluding to that. Look at that, how things were aligned. Today, it's only at 12%. We're not saying they can not do better. They can do better. But this is what I explained to the people yesterday from the Saguenay-Lac-Saint-Jean. You are facing a difficult situation, but look at what happened in Quebec. This is a very significant improvement here. And thirdly, what I want to stress here is look at the rest of Quebec. Regarding the zones that the Premier was alluding to earlier, this has reached more than 25%. The great news supporting this, there's always a great news here, is that we know where we must act if we want to bring back down our number of cases. We've seen improvements in Quebec and Montreal, and so they are being compensated here. This is offset by some situations where things are not going that well. And I'd like to finish here. In conclusion, I'm giving you this chart. Oh, I'm sorry. I'm not used to doing this presentation. But on the website, you will find the details about this. You see what's happening in Quebec comprehensively, and you see the Montreal region. It's as stable for all sorts of reasons. And you see here how Quebec has done very well. But in the regions, it's difficult. And so for each one of those regions, on our website, you will find the details, the breakdown of the different characteristics. If you want to know, for example, for the Greater Montreal region, why Montreal remains stable, even though it's going well in Montreal, it's because in Lanaudière, it's not going that well. I don't want to get into the granularity of these numbers, but on our website, you'll be able to find all the specifics so that you can answer your questions yourselves. Question from La Presse Canadienne. Good morning, gentlemen. The opposition party, the Quebec party, has said, Mr. Legault, that given the statistics, 38 deaths and an increase in the number of cases, in view of all that, they said that the Quebec government is at a loss of control. They're losing control of the situation. Answer, this is false, totally wrong. Facts speak clearly. At the beginning of the second wave, the date may change, right? From one country to another, the change might be different. But let's assume it's September the 1st. Since September the 1st, there were 76 deaths per million of inhabitants in Quebec. In the United States, this was 163. In UK, 109. Italy, 92. France, 146. In Spain, 208, in Belgium, 257. So we see those numbers when Dominique Anglade was saying Quebec is the worst place in the world for the second wave. This is totally false. This is a lie. I must say this. This is a lie. Now, what about the provinces? Well, as for the provinces, as I said it earlier, we will follow up on the over-mortality rates in Ontario, amongst things. We see that the situation is now difficult in Alberta, and even today there are more cases in Ontario than in Quebec. So we see that in British Columbia things are hard also. But in Canada, we would need to look at the over-mortality rate to be able to compare things. There might be an exception in the rest of Canada. But what I told you here is that for most European countries and for most states in the United States, they have more deaths than us per million of inhabitants. Question. You've talked about over-mortality, Mr. Premier. Dr. Arruda, you said yesterday that you asked for an analysis about over-mortality, realizing that over-mortality is higher than the number that's been reported regarding the number of deaths with COVID-19. What's the situation? Answer. The analyses are underway. They are being conducted, so I don't have the numbers right now. When I get the numbers, then I'll be able to answer your question. Sorry. Question. Is this concerning? Answer. No. The preliminary information I got about that tells me that no. But I don't want to say something that's not true, so I'll wait for the report. Question. You were talking about easing restriction in spite of what's happening in terms of sanitation issues in the red zones. You were talking about the CEGEP students. There are a lot of concerns on the side of students from the collegiate level, the CEGEPs. Is it possible for you, in spite of those restrictions, which are still sustained, is it possible to ease things out a little bit so that the situation be made easier for those students? Answer. We've talked about this with the public authorities, but until November the 23rd, there won't be a relaxing of those measures. Question. I'll be short. I know I must be, but wearing masks, following the guidelines, respecting the 2 meters and so on, we know about that. But what was done well? Why do we have great results like that in Quebec? Answer. To follow the guidelines, to do that well, look at what happened in Quebec. We look at some regions, for example, the eastern townships yesterday when we learned that some illegal parties are happening. Well, you know, there are outbreaks because of that. There's no surprise. Let's come back to what happened in Quebec. I don't want to come back, actually, on that. But I think that people straightened up. And so in terms of communication, I remember that Mr. Labaume with the Vice Premier, they did a press conference. They had held a press conference to explain things. And they said that there's no reason why in the greater Quebec region there should be so many cases. The main answer here is that we must follow guidelines. I'm convinced that in the Saguenay-Lac-Saint-Jean region, I'm sure that people will improve and will see some improvements soon. Question. Mr. Bernardel talked about the Quebec City tramway. He said that improvements should be made. If your minister does recommend that, are you ready to reopen the budgetary envelope, referring to the 2.8, which will become 2.9 or more million? Answer. Before the election, 2018, remember, we had 3 prerequisites before supporting the project. We needed improved services towards the suburbs, number 2, a link, and number 3, meeting the budgetary goals. Before the BAPS report, we had discussions with Mr. Legault about how to deliver services to the suburbs. There lies the level where we believe improvements should be made. Question from Le Journal de Québec. Mr. Legault, about the tramway, should we shorten the itinerary of the tramway in order to find more budget, in order to better serve, to provide better services? Should we shorten that itinerary? Answer. Nothing is excluded. We have to consider the traffic. In the BAPS report, we allude to that. Is there part of the tramway line that's not absolutely necessary, where there's less traffic, less passengers? These are part of the considerations that we entertain with the Quebec City, even before the BAPS report. Question. Do you think we can still shorten a little bit more the itinerary, the route for the tramway? Answer. It's not excluded. Question. But we should never go beyond the current budget, according to you. Answer. That was one of the prerequisites we
I would like to ask you a question on Heron,
submitted.
Mr. Legault. You have 2 private CHSLDs, that Heron in Dorval and Eden in Laval. They will be closing for good. Back in May, I remember you talking about the idea of nationalizing private CHSLDs. What you see right now, what's your idea about how should these homes be run?
Well, first, we haven't changed our mind that we need to take certain CHSLD from private to public. And I think we have demonstrated that not later than the beginning of summer with Waterloo. As you know, there were some contracts, and we decided to en faire transform them into CHSLD public. We did that in Waterloo. In the case of Erin, I'll be prudent, but we could not make a check to the owner. That was not a possibility for obvious reason, one of them being under exam with a coroner and everything. So all the negligence that have been done in Erin doesn't make that we will not follow our plan to privatize certain CHSLD.
To nationalize.
Yeah,
okay.
Exactly.
Okay. Talking about aerosols, about a week ago, the federal recognized aerosols as one of a factor of transmission. And now you see the Lester B. Pearson School Board, who went ahead yesterday and bought for about $500,000 ventilators, purifiers for 16 buildings that are not mechanically ventilated. How come we don't have a plan for schools? Winter is there, so how come we don't have a plan yet?
Yeah, well, this is exactly what I was talking about before, that we had a certain recommendation back in the spring. Conditions have changed, and I think you refer to the OMS opinion that was issued a few weeks ago. And the minute this was issued, we said, well, we have a different environment. We asked Santé Publique to come up with an update of that opinion. But in the meantime, we don't wait. We're asking our expert, what could we do as temporary measure? I give the example of air conditioning we done this summer. Remember, when we decided to act, we act very quickly with temporary measure. The one issue in school, especially in CHSLD, is we need the electrical power to power those units. And we found some solution with temporary electrical power unit for air conditioning. If we need to do the same thing for those units, we'll do the same thing. So we're looking at that right now.
Raquel Fletcher, Global.
Good afternoon. The federal government has promised to help provinces, and so I'm wondering what you think the federal government should do to stop the spread of COVID-19 in Quebec.
I think that first they need to have a better financing of healthcare expenses. You must have seen in the Ontario budget the repeated request of raising from 22% to 35% the federal share of the financing. Why is it so urgent and important? Because we need to hire people. And to hire people, we need to know if we'll have the financing in 2 years and 3 years from now. And so far, most of the money announced by Justin Trudeau since the beginning of March is non-recurrent money. And we need to have recurrent money to hire additional employees in the healthcare system.
You've seen that the school in Lévis that had dozens of infections of COVID-19. What happened here, and is this a concern for you for what might happen in other schools in the future?
Okay. First, I'm very happy to see that today we have a reduced number of classrooms that are closed. 32 less than the day before yesterday. So we are at 850. You must remember that we were over 1,000 a few weeks ago. So if you multiply that by 30 students per class, it means that it's less than 3% of our children that are unfortunately not going to school. So I think we were quite successful maintaining most of our children in schools.
Kelly Craig, CTV.
Good afternoon. This question is for Dr. Ruda. One of the members of the National Assembly this morning said in the Montreal region, schools are the main driver of transmission of the virus. Is that true?
In fact, schools is as open in the community are a driver of the virus, but it's not the only the schools. There is also It can vary from one subregion to subregion. The outbreaks are going up, going down in different places. As we know, when we open schools, there is some transmission in the community that is added. But I think it's a mix of things. It's not only one driver. That's schools, workplaces, and communities and homes too.
Okay, so just to be clear, that's not true then, that schools are the main driver.
They are part of, but not the main.
Okay. And my second question is also about schools. It's about to pick up on Ketsy's question about the ventilation. Is there going to be a province-wide plan about ventilation, or is it up to each school board or service center to decide what it wants to do?
Well, first, we want to have a view of the santé publique first, because as you know, as I mentioned earlier, the opinion of the OMS is very recent on the way this goes through air. So that has raised the question again, and I think that this was the main driver. Now, secondly, I think we can act locally much faster than we can. We have, and that's the reason I'm saying it's not only an issue with education, but with our health building, is that we have a building that don't have ventilation. So we need to be more specific on certain cases where if we have this opinion, then we'll act very accordingly. And that's the reason we've asked the responsible for our procurement to look at and have a detailed list so we can present those lists with our experts and make sure that we act very quickly on that.
Philippe Autier, de Gazette. To follow up on what Kelly just asked, while you're waiting for Santé Quebec to come up with a plan for ventilation in schools, what should schools do now? Today's a nice day, but it's going to get cold. Mm-hmm. Should they keep windows open? What should they be doing now to control the aerosol? Perhaps, yeah. Sure.
I think that, first of all, we must really understand how it contributes and in which conditions, because as we told, this is something that is looked and is not the major place of I would say, not the major place of transmission, not the first drivers, but I think there is some possibilities, like especially when there is closed classes or for a long time, to do aeration in between different periods. That could be recommended. And this group is also going to look at, is there any technologies that could be put in place to help? But I just want to make sure that people understand that ventilation is something we're going to look at, but it will not change the other things that are very important, distanciation, and washing and everything. If everybody puts now the energy on ventilation and forget the other aspect, I'm sure we're going to have more outbreaks. But that's an issue that we are looking intensively, actually.
And we have, since November 1st, nearly 160 deaths now, which is a very high number. Is there anything, I know, Mr. Legault, you said you would not be putting in new restrictions, but are there short-term measures that you could add to the pool of measures that you have to try and bring that rate down?
As you know, if I may, as you know, most of the deaths are either in CHSLD, RPA, or à domicile, and they are mostly with people that are over 70 years old. So the focus should be definitely on CHSLD, and as I mentioned earlier, they should be in certain regions that were not affected by the first wave. So this is the focus that we do right now, and that's the reason we had those meetings in the last few days, and we're asking everybody. I asked the PDG, I asked local, we're having calls every day with them to make sure we'll have a specific campaign to repeat the measures. I've asked the collaboration of the unions to make sure that when they talk to their employees, they pass the same message. It's really an effort of everybody that we need to, especially in CHSLD right now, because we have been able to contain it, but we are under a lot of pressure, and we should put the focus there.
C'était la dernière question. Bon après-midi à tous.
This was the last question. End of session.